to The Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. With me today is my colleague and co-author, Wendy Benson. When we released our book last year, we were in a more flexible and fluid healthcare environment than we are in today. And the dialogue and relationships outlined in our book between patients and the medical community are even more important now. Joining us today is Dr. Janine Gauthier-Milady. Dr. Milady is a clinical psychologist with Life Reset Solutions. Let's start with some of our recent experiences given the challenges many patients have faced in the last few months. Wendy, take it from here.
Thank you so much for joining us. You know, there have been so many new challenges with COVID-19, with our patients, with every part of our lives, really. So Janine, can you tell us a little bit about some of the challenges that you and your patients have faced during this time?
Absolutely. Yes, from the time that this coronavirus and COVID-19 began and we were all told to stay at home and shelter in our homes, you know, it really changed how we had to think about seeing patients. And telehealth has been an option for many medical providers for quite some time, but in this day and age, we had to shift how we thought about seeing people. And normally, as a psychologist, I see someone in my office and we're there together in the same space, but we had to really shift how we were able to be together even though we were apart. And so we had to shift into doing more video sessions and doing our sessions from home, which can be challenging for people, you know, on a number of levels.
You know, loneliness, they say, is a problem even in normal everyday life. But over the last few months, we've all had to be so creative in terms of how we address those needs person to person. You know, who's at risk for being lonely, and what are some, you know, advice that you have when people are going through those wide range of emotions?
Sure. Well, I think that's one of the biggest challenges that many people have faced is feeling very lonely and very cut off in this world. As you know, we had to stay at home, and if we lived alone and we were single, it really kind of amplified our sense of feeling lonely, because many times we would connect with friends or colleagues at work, and that would help us to feel less lonely. I think loneliness is something that we all are at risk of experiencing in our lives. Even sometimes there are people that might be in a crowded room and still feel quite lonely. And so then you add to that, you know, this where we aren't able to even connect socially at all with anyone, and that can exacerbate our feelings of loneliness. So I think really anybody is really at risk of getting lonely. It's really, loneliness is an emotion that we all can experience from time to time. And there are, you know, when you add then into that mix the fact that we aren't able to engage in our normal activities, you know, maybe going out and running with friends or meeting people for coffee or dinner, you know, that then makes that feeling even worse.
So when you have patients that are having difficulty with, you know, anxiety, chronic disease, like how do you help coach them through that at such an unusual time?
So I think that that's a great question, in that just because we have coronavirus, it doesn't stop people from having chronic conditions, depression, anxiety. And in fact, I think what we've seen is it's on some levels made that even worse, because now we add into the mix this knowledge that there is a virus out there that we don't know who has it, and they're contagious. And so then everybody becomes potentially an enemy because they might be sick and they might get us sick. And so I think that that can then, when we feel under threat and as though things are dangerous, physiologically our body responds in such a way that it amps up our level of anxiety. It amps up the cortisol, it amps up the adrenaline. And so we feel more anxious. And I think so what we do to try to address those needs with people is let them know that what they're experiencing is very normal, and that their anxiety or their depression that may absolutely be experienced at a greater level. So what we want to do is we want to try to find tools that will help them to maneuver through these times. And so we might find ways to help them get involved in some sort of activity they can do at home, find something that they enjoy, help them to encourage them to reach out to people that they would maybe go and see in person. We encourage them to try to connect with them via FaceTime or Skype, or Zoom is the word of the day. Zooming, everybody is Zooming from home. And so, but letting them know that there are people out there, and then also letting them know that if they are having a crisis, that they need to get to the appropriate resources, and making sure they know where those resources are and how to access them. I know a lot of people were concerned about going to hospitals, and so somebody that might normally go to the hospital, the ER, if they were in the midst of a panic attack, or even their doctor's office, they might shy away from that now because they're so afraid of that. But encouraging them to reach out to their physicians, even if they're fearful of going into the office, but reaching out to those appropriate resources. And we may schedule an extra session or two, to make sure that they have the support that they need, and finding people in their lives that they can reach out to that will be a support to them and will understand and appreciate where they're coming from, whether they're depressed or anxious.
Janine, I just think that that's such an important piece. So many things that you said, some of which is if we're feeling concern and anxiety and fear about taking care of our medical needs, instead of just not paying attention to that, to really contacting your medical provider, your physician, your nurse practitioner, someone on the team, because they're taking steps to help us feel more supported and doing things proactively to be sure that it's a safe environment. But I think having that conversation with your doctor can really be helpful. So I think that that's just an excellent takeaway.
Absolutely. And I think that's one of the most important aspects, is to make sure that people are able to feel comfortable reaching out, even if it's by phone. And most providers are now doing virtual telehealth video sessions. And that is something that, if that is a way to connect with your provider, to make sure that there isn't something more serious that really does need to be addressed, and making sure that they understand that healthcare providers are very well aware and are doing what they can to make sure that it is safe, and as safe as possible, for people to come and see them.
Mm-hmm. And so, what other modifications have you and other medical providers needed to do in light of what's happening in the current situation?
So, yeah, I think that certainly being more flexible in how we approach what we do and how we provide support. And it may be that we need to increase how often we see someone, to make sure that they are having their needs addressed. And some people, they don't like the telehealth, the video component. So we might do something by phone, and we have a phone call. If somebody's not either feeling like they're technologically savvy, there are many ways that we can provide that additional support for them, to make sure that they're getting their needs met.
I was just going to say, I just think that's such an excellent point, because I think that knowing that we're not the only one going through this, there's a validation to that. We don't feel as lonely if we know that our colleagues, friends are also going through the same emotions. Go ahead.
Yeah.
I was going to say, I find it very interesting. Like, it's another piece for the clinician to see the patient in their own environment. And have you noticed that, like, you're like, oh, that's why she does X, Y, and Z, because you're seeing how their house is set up, or maybe how dark it might be, as opposed to, like, let some sunlight in and get some, happiness in here. Are you seeing any of that doing these video interviews?
Absolutely. And I think that actually that's a great point, is, it's been so interesting to, even when we look on the TV, everybody's in their home environment. And so then when we do the video session, we are seeing people in their home environments. And I think it also helps. Sometimes people are much more comfortable when they're in their home. And so many times they actually might talk more freely or more openly about what they're struggling with because they're in a safe environment, or what might feel like a safer environment of being in their home. You know, sometimes when they come to the office certainly after a period of time becomes comfortable. But I think when we see people in their homes, we are able to kind of see a little bit more. We get a snapshot of maybe what's going on. And so we can help to identify, gee, you know, I had one person that he had been very, very sick with a medical illness, and he had one particular chair, and it was in one part of his room, and he sat there and had to sit in the dark because he had such horrible headaches. And so he was really struggled for quite a while. Well, so then he made a comment about that, and we strategized and just said, well, what about if we just moved the chair to a different part of the room? Can you do that? Can you move it into either a different spot? And he did, and it really kind of helped him to kind of take a different view of the world, and it got him out of that past sickness role, because now he's not sick like that, but he was so accustomed to sitting in that chair and just doing nothing.
Yeah.
So just shifting things around and saying, hey, why don't you move this? Or why don't you, we can certainly kind of look at what's going on and maybe make some suggestions about how to help them take a step and have some structure in their world.
Yeah.
That's so inspiring when you can make a difference with something like that, right? And to your point, if they had been only seeing you in your office, there might not have been that opportunity to make those sorts of connections.
Absolutely. And so, it was really quite interesting. And actually just having moved that, it really kind of like shifted something for him to where he was then more open to taking other risks of doing different things.
That's great. So, with the privacy laws the way they are surrounding healthcare, when you think about advice for your patients and their loved ones, if someone's helping to care for someone else, are there things that you can recommend in terms of getting, information from the medical providers for medications, appointments, follow-up, that type of thing?
That's a great question, because I know with, the privacy, for telehealth and for doing that, certainly we have to be very cognizant that we're on a secure platform. And, for family members, certainly, obviously, I think that the privacy rules still apply. And so, for a family member to talk to the physician, there needs to be some sort of understanding that it's okay if my daughter or my son or my spouse kind of has that information. There still needs to be those privacy kind of components in place. So I think as long as those things are there, and that there's an understanding that, yes, I have a release that my spouse can get information from my doctor, that's important. I mean, is that what you're asking me about? Is that, I want to make sure I'm understanding when you say privacy, because it's just as the same as any other if the person was being seen in the office. I think one of the challenges is when we're doing these telehealth visits, that's where it can be somewhat kind of challenging. But, as a provider, I'm always making sure, are they alone? Do they feel comfortable? Do they feel like they have the privacy that they need to be able to discuss whatever topic it is that they want to discuss, and not feel like there's, small children running around, or their spouse if they need to, talk about things.
One of the things that Beth and I have noticed also is that, before a loved one could be at a clinic visit with someone or in the hospital beside them. And now with that not being the case, there's been a lot more emphasis on making sure that the medical team knows who your direct contacts are and who that designated person is, so that communication can continue to flow without that extra set of eyes and ears physically being beside the person that's in the hospital.
Yes. And that's been one of the biggest challenges, I think, that I've heard from people that do have a loved one that say has to go to the hospital, and they're like, well, I can't go with them and I can't be there with them. And so that creates anxiety for the partner, the spouse, the loved one. It can create some real anxiety for them because they're not seeing what's going on. They're not able to be there with their loved one, whether it's at the clinic visit or in the hospital.
Great. So, Janine, I know you have offices both in Glenview, Illinois, and in Chicago, Illinois. Now, with everything that's happening recently, I'm sure the visits are primarily happening over telehealth or the telephone. But can you tell us a little bit about your practice?
Absolutely, yes. So we are right now telehealth, but we do have two offices in the Loop and in Glenview. And the practice is primarily I work with people that have illnesses. My background is as a clinical health psychologist. So for 10 years, I worked primarily within oncology. I still do see quite a few of my patients who are struggling with either cancer or a loved one has cancer. But I also work with people that are struggling with other chronic illnesses, diabetes, chronic pain. And then I have a component that is just, I'm dealing with depression, or I'm dealing with anxiety, you know, and so I think we provide a number of resources because there's so many ways that it's all interconnected. Both the medical and the emotional is connected. And so if we are struggling with depression or anxiety, we know that that can compromise our immune system. And so that can then downregulate and compromise that immune system. And if we are dealing with something that's impacting us physiologically, physically, and we have an illness, that affects our emotional well-being. And so I take a holistic approach and I look at the individual as a whole person, and we work with you as an entire person, and we try to identify how do we find ways to help you both manage the physical and the emotional and integrate those so that we are addressing all of their needs.
And you do such a fantastic job at what you do.
Well, thank you.
You're very, very talented. So thank you so much.
I appreciate that.
If you would like to connect with Dr. Mulady, visit www.liferesetsolutions.com, or her email is jgmulady.phd@liferesetsolutions.com. Be sure to check back with Wendy and I as we continue our conversations with medical experts as we help the confident patient in a new world.
And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.
Thanks.